Hi, my name is Amanda and I'll be talking about type 1 diabetes today. Type 1 diabetes is an autoimmune disease in which the pancreas makes little or no insulin. It is often diagnosed in kids and young adults, but it can present at any age. Most common symptoms of type 1 diabetes include feeling more thirsty than usual, urinating a lot, feeling very hungry, having blurry vision, feeling tired and weak, and losing weight without trying. Over time, type 1 diabetes complications can affect major organs in the body. These organs include but are not limited to the heart, blood vessels, nerves, eyes, and kidneys. Diabetes complications can lead to disabilities or even threaten the person's life. Risk factors for type 1 diabetes include family history, which involves anyone in the family with type 1 diabetes. The second risk factor is genetics. Certain genes increase the risk for type 1 diabetes. Lastly, age. It is more common in children between 4 and 6 years old and children between 10 and 14 years old. To better understand type 1 diabetes, we need to know how does insulin work. But first, we gotta take a look at glucose. Glucose is the primary energy source for the cells that makes up muscle and other tissues. Sugar is absorbed into the bloodstream where it enters the cell with the help of insulin. Insulin is a hormone that comes from the pancreatic gland. It is produced by specialized beta cells, which are clustered into groups called islets of Langerhans. Insulin travels through the body, allowing sugar to enter the cells. It then lowers the amount of sugar in the bloodstream. What causes type 1 diabetes? The immune system has an unknown trigger that causes an immune response. This response destroys insulin-producing beta cells, which, like we stated, regulate blood sugar levels. The exact cause of the immune response is unknown, but it is widely accepted that genetic and environmental factors like viral infections may inadvertently trigger the autoimmune process. The immune response includes both innate and adaptive immune components. Innate components of the response include macrophages and dendritic cells, also known as antigen-presenting cells. The adaptive components of the response include T cells, B cells, antibodies, and antigen-presenting cells. Insulitis is the characteristic inflammatory lesion of type 1 diabetes, defined by an immune cell infiltration in and around the pancreatic islets of Langerhans, particularly the insulin-producing beta cells. The infiltrate is mainly T cells, with contributions from B cells and innate immune cells. It represents the local autoimmune attack that leads to progressive beta cell dysfunction and loss. T cell involvement in type 1 diabetes. T cells, both CD4 and CD8, are responsible for the killing of insulin-producing beta cells. Upon activation by antigen-presenting cells, the autoreactive T cell causes progressive damage to pancreatic islets. This leads to sustained loss of beta cell function. CD8 T cell specific involvement. Autoreactive CD8 T cells are activated through interactions with peptides presented by MHC class I and can mediate beta cell death in a content-dependent manner through perforin and granzyme molecules. Granzymes enter the beta cells through pores created by perforins. They then cleave specific proteins involved in the regulation of cell survival and DNA replication, leading to cell death. CD4 T cell specific involvement. CD4 T cells recognize beta cell antigens on MHC class II molecules. According to studies, HLA, short for human leukocyte antigens class II alleles, DR4, DQ8, and DQ2, confer the highest genetic risk for type 1 diabetes in human patients. This strong association suggests that HLA2 enhances autoreactive CD4 T cells activation. This plays a key role in disease pathogenesis. This is due to CD4 T cells' ability to provide help to B cells and stimulate antibody production. It also promotes responses by effector CD8 T cells and stimulate isolate-resident macrophages. Beta cell death can also be mediated through cytokine production by both CD4 and CD8 T cells within pancreatic islets. Pro-inflammatory cytokines such as TNF-alpha and IFN-gamma produced by T helper cell 1 and interleukin-17 produced by T helper cell 17 are directly toxic to beta cells. These cytokines also activate macrophages and stimulate a positive feedback loop, further increasing cytokine production in situ and killing more beta cells. B cells involvement in type 1 diabetes. B cells act as antigen-presenting cells to both CD4 and CD8 T cells, aiding in their response rather than directly killing beta cells. They also produce autoantibodies against insulin, the isolate proteins. What is the cure to diabetes? Due to the mechanism in which type 1 diabetes is developed and how it progresses, there is no cure for diabetes at this time. The current treatment consists of lowering the amount of sugar in the bloodstream by injecting insulin, diet, and lifestyle to prevent complications. There is ongoing research for a way to modulate the immune system to prevent or reverse the autoimmune attack on beta cells. And that's everything. Thank you for your attention.